Hi, my name is Jill Ferry. I'm a physician assistant. I practice in Harlan, Iowa, and I am honored to have been asked to be a part of the University of South Dakota Relay for Life. I was hoping to be there in person, but due to our viral pandemic, I'm here and supporting your cause in any way I can. I want to present today an avenue of cancer awareness, and from a provider point of view, I bring three cases that are really near and dear to my heart. And each of these three ladies were diagnosed with cancer at a late stage, and unfortunately they all have passed away. The first patient I want to talk about was a colleague of mine. She was a 52-year-old nurse. She was my friend. She was a mother. She was a wife. She was a grandmother, a sister, and just an all-out great lady. Her name was Nadine. She presented to my office in April of 2010 with some nonspecific abdominal symptoms. She had been running a fever for a few days and had some urinary symptoms. We worked this up and really could not find any specific cause that day, and so I proceeded to do a CT scan of her abdomen and pelvis the very next day. The results of that were devastating. She was diagnosed with stage 4 ovarian cancer. Women who are diagnosed with stage 3 or stage 4 ovarian cancer have about a 25% chance of survival at 2 years. Nadine underwent 3 rounds of intensive chemotherapy, each time knocking the cancer down but never curing it. In the summer of 2014, the cancer came back in a vengeance the 4th time. She tried the chemo again, and unfortunately, it took her life in August of 2014 at the age of 56. I bring her case to light because she taught me a lot as a caregiver to be a better teacher. She had symptoms, but she did not think that they were anything to be concerned about. So as a result of what she went through, I am an advocate for her now to try to make ovarian cancer awareness to younger women and to older women. I have cards that I hand out to each one of my patients now to know the signs and know the early signs, because if we're diagnosing ovarian cancer at an earlier stage, it is truly curable. The second patient is a lady by the name of Julie. She was 59 when she was diagnosed with stage 4 lung cancer. Julie was also a friend of mine, and she was a colleague. She was a nurse who actually worked down the hall in my office. Non-smoker, never smoked at all in her life. I remember hearing Julie cough continuously on a daily basis, on and off, for a full year. Julie had seen an ear, nose, and throat doctor. She had seen a gastroenterologist. She had a chest x-ray, which was initially negative, but the cough progressed and the cough changed. And she was seen again, this time with an atypical chest x-ray, proceeded to have a CT scan, and unfortunately was diagnosed with stage 4 lung cancer. Julie lost her battle 2 years after her diagnosis, and it saddens me because she had symptoms, but again, felt that maybe it was something else. The third patient is actually a family member. This is my mother. Gloria was 77 when she started having some weight loss, nonspecific muscle pain. She had some joint discomfort and just change in her appetite. She proceeded to see her physician a month before she died and did have some blood work, but unfortunately did not have a complete blood count. She was told that she had a condition of polymyalgia rheumatica, was given some steroids, and she actually got better. Unfortunately, in the fall of 2016, my father called me, and my mother had collapsed at home. This was on a Saturday. We called the ambulance, brought her to our local emergency room, and a complete blood count was done. I recall the physician telling me, "Your mother has leukemia." She was transferred to a higher facility on that Saturday. She had a bone marrow biopsy on Monday. She was given 9 units of blood products. So that's my speech to donate blood. But unfortunately, my mother passed away on Tuesday. We did not find out her diagnosis of acute myeloid leukemia until 10 days after she died. My point is that all 3 of these ladies had symptoms, but unfortunately all 3 of them were diagnosed at a very late stage. It's easy for us to dismiss as medical providers, but also as patients that, oh, my symptoms are being caused by something else. Be an advocate for yourself and listen to your body, because cancer whispers. If you see a provider and you do not get the answers that you feel you need, go see a second provider. I want to thank the Relay for Life Committee and the University of South Dakota for allowing me to be a part of this event. Stay safe, South Dakota, and go Yotes.